So, good evening, all of you, and welcome to this workshop on sleep and mindfulness. So, here we will be trying to understand something very important about our sleep as well as the use of mindfulness in this. I am Dr. Anirban Pal, and I will be taking you through this workshop. And this is organized by Harmony, which is a meditation center by medical experts. So, all set, we are going to take you through this workshop. In the first part of the workshop, majority of the workshop, you will be muted. In the At the end part, we will be taking some of your queries regarding this. So please listen very carefully. So this is just a recapitulation of the last workshop, which was on mind care. In this workshop, those who have attended it, you know that we encouraged all of you to start with mind care. We told you to appreciate small things in your life, which are in that way positive things which are happening in your life, because that will be having a positive effect on your mind. And we also motivated you to develop a helping attitude, that small helps if you can reach out to people around you, that is also having a good effect on the mind. And regarding mindfulness, this is a mind training which helps to understand your mind better and helps in caring your mind. So just a snapshot of this workshop which was held last month, and those who want to know more, or those who have missed this workshop, you can just find this in our YouTube channel. In Harmony's YouTube channel, this recording is available, so you can just log in and get through the session and understand it. So directly coming to today's workshop on sleep and mindfulness, I shall be starting with a real life story. So you see that I am associated with this organization Harmony for nearly now 7 years, and we basically teach mindfulness meditation. So every day I get a number of calls from different people, and these calls are very interesting. So I'll start with a story of a call. So one day I got a call from a lady, and this lady uh, started with a general query that, do you teach meditation or do you teach mindfulness, and some general queries about this thing. Then she asked me that, I have a very specific query to you. I said, yes, you go on. What do you want to say about yourself? This lady said that I am suffering from sleep problem. So basically, I can't sleep for the last 1 year. And someone has told me that meditation can help me with sleep. So that's why I have called you. Now, I said that you must be visiting some doctors and taking some uh, professional help regarding this. And then she said that I have already tried all those things. I have been to a number of specialists to take help regarding my sleep in the last few months. And I have also tried a number of therapies. And but unfortunately for me, those things have not worked. So I was thinking of trying out mindfulness meditation. And she asked me, what is your opinion regarding this, or what is your suggestions regarding this? So, being a doctor myself and being a meditation instructor or a mindfulness instructor for the last 7 years, I remained very true to myself. And I said that, look, a lot of people who have done this course or who practice mindfulness, they have told me that it has improved their sleep. Okay. So it can be beneficial. Mindfulness can help you in your sleep. Hearing this lady, she asked me that, no, no, not like that. You are saying that it might be helpful. I need a sort of assurance from you. So you see that people want some sort of guarantee. You say, if you only say that this is going to help me, if you only say this is going to solve my problem, sleep problem, then only I am interested in getting into it. Okay. And if you don't give an full assurance, 100% assurance that this is not going to help me, so I have to think otherwise. So in this position, I said that, look, I cannot give you 100% guarantee. So because you see, mindfulness and meditation, these are a little complex things, and these are not like medicines. So it depends on multiple factors. It depends on the person who is practicing this, how much committed that person is, or what is the intent of that person, what brings that person to this, a lot of motivation, how much that person is motivated to take it forward. So a lot of factors come in this process, and that those factors actually determine the results. So this is my experience with this mindfulness thing. But you can try. Now, this lady was very adamant and she said that, no, no, unless I get a full assurance, I cannot come into the course, because I have already tried a number of methods. I have already tried a number of therapies, and I have been to a number of specialists, and all this has failed for me. So I don't have much faith in trying something new or something like this. Now, then I said that I can only do one thing for you that is possible within my limits. Is usually we have a course fee, and as you are not yet convinced that whether this is going to work for you, from my end I can uh, just gift you this, that you can do it without fees. Okay. Because you are not sure, you don't have much faith, and neither on me nor on the process. So obviously, but one thing is, the urge is genuine, because the way she was speaking, she was generally interested in the process, that I could understand. So I said that that is the only thing I can do on my part. And she joined the process. So she started with the structured course of mindfulness. And this course usually have 5 sessions, and it is around a month long. So the course was going on, and in between we have interactions. So the interactions were very minimal regarding the sleep and those things. I asked her maybe once or twice, and she said that, I'm doing it, but let's see how the things go, just like this. Not a positive, neither a negative sort of result. Now a very interesting thing happened in the last week of the course. It was coming to an end. The fifth session was they have already completed 4 sessions, and the fifth one, we're going to the fifth. Maybe 3-4 days left in just completing the course. So I got a call from this lady again, and she said that, sir, I want to pay you the course fee. So I said that I have already gifted the course to you, because you didn't have that amount of faith into this and you are not sure. She said, no, because out of gratitude, I would like to pay the course fee to you. because for the last few days, I have not told you I'm sleeping. So after maybe a gap of 1 year, so I've not been sleeping for the last 1 year in that way. And for the last 2, 3 days, I have again started sleeping. So it has worked for me. So I was more happy than this lady. And I said, okay, then it's a nice thing. And it has worked for you. Now, I think this is a real life story of a person who was finding it very difficult to sleep and was taking medicines and have been to a number of doctors, have been through different therapies, and nothing was working for this particular person. And fortunately, mindfulness came to a rescue. But you see that this story actually gives us a lesson. And this lesson is that our minds are very important component in our existence. And our minds are just like mirrors. So I think one of the best way to describe a mind is that it is just like a mirror, and it reflects your life. So what is going on in your life, or the journey you are going on through your life, it is very well reflected in your mind. And the sleep is very closely related to the mind. So the relationship between the mind and the sleep is bidirectional. You will see that if there is some issues with your mental well-being, or you are not doing well in this field, as many of us, so you'll see that your sleep is being disturbed. And it is the vice versa also. So if your sleep gets disturbed, or if you are not having a good sleep, so you'll see that your mental well-being is being getting affected. So very close relations with the sleep and the mind. And some facts to share with all of you, that these sleep problems are very common. So many of you may be suffering from these problems. Maybe some of you feel shy to tell these things. And if you are not suffering, you will find people in your family or among your near and dear ones who are suffering from these sleep problems. So quite common. It is so common that India is said to be the second sleep deprived country in the world. So many of us, we are suffering from sleep problems. It is so common. And if we can understand a few things about sleep, it will be helpful for us, as well as we can share with other people and can help them also. So there is a common tendency that if someone comes with a sleep problem, it happens with us doctors also, that if you go to a doctor and just say that you are having a sleep problem, so you will be given some medicines straight away. And it happens to us also that, so once we are having a disturbed sleep, so many of us, we are into the healthcare sector. So we have an habit of taking some medicines which can help us in this process of sleep. So we start trying some medicines. My advice or request to all of you will be to, if you are having sleep problems, or if you find someone who is having sleep problems, there are certain things, basic things, which one needs to understand. And there are simple remedies which any of us, we can try out before you go for medicines. Because once you start taking those medicines, you have to continue this for the rest of your life. And even we see that sometimes the low doses or maybe a single medicine does not suffice. So you have to increase the number of medicines also. So every medicine, as doctors or as healthcare providers, many of us know that they will be having their adverse effects or side effects. And directly jumping to medicines is not a very wise way, because I see a lot of patients every day, and it is very common. Almost alternate patients have some sort of anxiolytic drugs or some sleep medications prescribed in their prescription. Even sometimes the person even is not aware that he or she is taking a medicine only to facilitate his or her sleep. So I think this awareness is very important. And let's first understand that why the sleep is getting disturbed and what are the three most common reasons which is causing a disturbance to your sleep. So this you can find in the net. You can just check in Google or such databases. You will see that the major reason of a disturbed sleep is this high stress. Unfortunately, in our country, in India, I have seen a lot of people who don't even understand that they are getting stressed. I'm talking about mental or psychological stress. So the awareness is so low that many of the people, they even don't know they are suffering from stress. That is a major problem. And India is number one in mental health diseases in the whole world. And almost nearly 80% of the people in the healthcare sector, they are suffering from stress. So you see that stress is so common, and high stress is also very common. But many of us, we are not even aware that we are suffering from high stress. So you are just thinking that why my sleep is disturbed without understanding that you are a person who is suffering from stress. So it's very important that you start understanding if the stress levels are high. Some people coming to us, previously we used to have some screening tools giving to each and everyone who is to come and join our courses. And when we ask those persons that are you suffering from stress, or you tell us something about your life or whatever, so most of the people are not so open to discuss their lives and their problems. And but we found that in the questionnaires, in the stress questionnaires, they are scoring very high. So on inquiring further, we found that they are suffering from high stress. So many people, even after that, they would not admit that they are suffering from stress, and they would not take professional help. So they are in a non acceptance mode. So the more we become aware of our own problems, the more we accept our own problems, the easier it becomes to deal with stress. So this is a major cause, this high stress in our life. And those who are healthcare providers, because we are working in a very different work field, so we are more prone to this high stress. Okay, so please be aware of this problem. Try to understand that whether you are suffering from stress. Sometimes I feel that many of us, we are just like the dreamers. You see that when you are dreaming in your sleep, you don't understand that you are dreaming. And as you wake up, you understand, oh, I was seeing a bad dream or I was seeing a nightmare. So people are just like daydreaming in their life. They're going through certain circumstances or certain things in their life, just like a daydream, and they are not even aware that what is going on in their life or how they are getting affected. So early recognition and more awareness will be helpful to understand this stress. The next important thing is excessive screen time. So this has come in the last few years as a major hazard to all of us. And many of us, we are still in the denial mode. So a lot of net usage and a lot of digital toxicity coming into our lives. And it was found that 80% of the Indians use phones before bed. So many of us, we have this habit that at the end of the day, when your work is done and you are relaxing or you are just taking your time to go to the bed, you just start scrolling your phones, or maybe you take help of other digital medias and those things. So you are just going on watching, and the screen time, you are just going on through this. This is a major cause of your sleep disturbance. So many of us, we are not even aware. We want more amount of it. And even we are not aware of this, we are creating our own problems. So this is just a statistics to tell you that we are slowly getting addicted to this screen things. And it's better that we start understanding this addiction. And obviously it will have its adverse effect. So it is affecting our sleep. And the third thing is the erratic work schedule. So as a healthcare provider, you are into different work schedules. So many of us, we have night duties, we have some other types of duties, and a little different type of work schedules. And these are something which is affecting our sleep. And one thing to emphasize in this is not only our work schedule. Sometimes we ourselves also are getting into some work which is not within our scheduled work. Okay. So you yourself, you make a choice of doing something, and the whole schedule gets erratic or it gets very irregular because of certain things. Maybe you overcommit for certain jobs, or it can be outside your job also, maybe from some social commitments, maybe somewhere where you could have said a no, or you could have set your limitations just to for your own mental well-being or your own psychological health. But it so happens that we are just crossing those limits and making wrong choices, which makes our schedules more erratic and irregular. So if these things are happening, these are going to affect your sleep. So before we get into the details of this, okay, that how you can actually, what are the remedies of improving your sleep and those things. maybe before you start with the medicines, something which you can try out, just make sure that these factors are not affecting you. And if these are affecting you, that you are suffering from high stress, so take care of that. Start understanding stress and how you can deal with it better. On your part, there must be something to do. Something will be non-modifiable. Something may be related to the work environment or the organization where you are working. Those things you cannot directly change. But on your part, there must be certain choices where you can execute those choices and deal with your stress better. If you are having excessive screen time, many of us, we are not even aware how many hours we are spending on this. So please be aware of that and try to digitally detox yourself. So these are just very simple things. These are simple, but they require a lot of motivation to just implement. So please be a little aware of doing these things and getting yourself into digital detox. And erratic work schedule. So if uh, your schedule demands this irregular type of work, my suggestion will be that in certain cases where you are making the schedules irregular or your contribution is making the things more difficult, there you can execute your choices. So many of the factors out here will be non-modifiable, where you cannot do anything. But again, there will be many areas where you can actually do. So my way of dealing the thing will be to focus where you can actually change or you can actually execute your choices. And those areas are not small areas, they are also large areas. So instead of just going on blaming your environment, blaming your organization, blaming your work schedule, everything, people around you, so you go on blaming from the everyone, everyone from the PM to the sweeper. So start looking into yourselves and you will see there are many things you are doing wrong in your life. Start with your self correction before you go and blame other things in your life. Okay. So please be look into these matters, and these are definitely going to help you. So if these factors are there which is disturbing your sleep, take care of them. Now I will be suggesting something which we call as simple remedies. These are simple, but these are important. And there is a some sort of medical term or a scientific term to describe these things. It is called as sleep hygiene. Okay. So how to make our sleep hygienes better? So simple things. So before you start with a drug, before you commit to a medicine, you can try these simple things. And these are simple, but these are important. These are effective. Okay. And one of the participant has asked a question about, I think the questionnaire I was talking to measure stress. I will come to it. So don't worry. So the first thing is a consistent schedule. So suppose at night you go to sleep around 10. Okay. So be consistent with your schedule. So try to maybe within 10 to 10:30, try to maintain that schedule, that every day you try to get to sleep at that time. And most of us, we go stray from that schedule. Maybe today is a weekend, today, tomorrow, maybe I don't have my usual duty. So you change your schedules. So you stay awake for a longer period, and maybe one day you are sleeping at 12, one day you are sleeping at 1, one day you are sleeping at 2 in the night. Okay. So if you are continuously, if you are varying your schedules, it becomes difficult. So have a flexible schedule, maybe something which is doable, and try to follow that schedule. So if you fix it from 10 to 10:30, so just make sure that within 10:30 you go to your bed. This is possible. Okay. It is not so difficult. Try to maintain a consistent schedule for your sleep. The next thing is the bedroom environment. This is very, very important. So you see that most of us, we are into families, and so a lot of things come into action when we go to sleep. A lot of factors. So I can only share my experience that when I go to sleep, so my wife and my son, they have a habit of chatting. Okay. So at the end of the day, they find it very nice that they would be just, the mother and the son duo, they will be just going on chatting on different things of the day and their life. And that's a very nice chat. Okay. But from the sleep part, that is very disturbing. And no one knows that how long that chat will continue. Okay. It can continue for 10 minutes, 15 minutes, or it can continue for an hour or maybe more than that. So the third person who is just sharing the bed, and maybe that person has to go to the hospital next day morning, early morning. So, and if there is a continuous chat going on, so obviously that environment is not conducive for a good sleep. So continuously a disturbance going on. So this is just an example. There can be a number of disturbances going on in different ways, and maybe you can have some choices to execute here so that you get a better bedroom environment. Okay. So some sort of disturbance, and you ensure in within your limitations, if it is possible, to have a more peaceful bedroom environment for your sleep. So if you can just make it sure. And the third thing is pre-sleep routines. This is very, very important. So as we were already mentioning about a lot of digital toxicity and a lot of internet usage, or uh, usage of digital media. So one thing is very important, that suppose you are planning to sleep between 10:30, that is your time. So for the maybe for an hour or so before the sleep, you should be slowing down. You should be getting ready for this act of sleep. So if you are just watching your phone and you switch it off, or you just stop that phone and you just go to sleep, the things are not going to be helpful in that way, because some sort of stimulation is continuously going on. It is stimulating your mind, and suddenly you stop that stimulation and you expect within 2 3 minutes or within 5 minutes you are going into a deep sleep. That can happen, but if that happens, then you are a blessed one. So it's important that for the last 1 hour of the sleep, you just do certain things which we call as routines, which are less stimulating activities. And preferably, you switch over from the digital to the non digital mode. Okay. You can just listen to music, or if possible, or maybe just going through some storybooks, whatever. It will change from a person to another. But maybe if you are planning to sleep around 10, so from 9 onwards, you make sure that you don't get into certain things which will be stimulating for your minds. So you don't start with a watching a web series thriller and a lot of engrossing one. So obviously, or you start with some ghost related web series. So those are very, very stimulating ones. Okay. So these are some choices you have in your hand, and this you can execute. You have to find out within yourself and as per your choices that what will be my routine for the last 1 hour before I go to sleep. So you will be making your own choices, and which will be helpful so that I can sleep. And this is very interesting. The fourth one is having a backup plan. So a lot of people ask me that what will I do if I don't get into a sleep? Okay. So please understand that sleep is a form of relaxation, and it is very important. So it is important for each and every one of us to have a 6 to 8 hours of sleep every day, and that too of good quality. And if you have listened to the previous workshops, you have already known that you cannot compromise on this part, that this 6 to 8 hours of sleep. So many of us, we have this tendency to curtail our sleep time and utilize it for other work. So that is a dangerous thing you are doing. So our bodies or our lives are just like a machine. So all the machines, they need rest. Okay. So your human body is nothing, just a machine. So you have to give it at least a 6 to 8 hours rest for its proper functioning. Okay. Now, one thing is super important, that if suppose the sleep doesn't come to you naturally, so you need to have a backup plan. So sleep gives you relaxation. So you can just switch over to certain things where you will have that relaxation. Okay. So that is not a substitute of your sleep, but it is something that it gives you quite similar relaxation. Because suppose you are unable to sleep, what you will do? You are trying it, it is not happening. So there can be certain options. So those who do meditations, I tell them to practice certain methods, that you can go on using those methods again and again, and maybe all over the night you can just go on practicing without panicking. Okay. Because they will give you that sufficient amount of relaxation even without sleep. And maybe, who knows, that after you go on doing this for a few days, after some time the sleep will come. And when the sleep comes, just welcome it. So you do that, those processes for maybe few minutes or few hours, and when the sleep comes, just welcome the sleep and go to sleep. Those who are not into this meditation things or mindfulness things, so you can just utilize some other methods You can just some of your, there are a lot of relaxation music and those things are available, a lot of other resources. So whichever suits you, you have a backup plan, that if I'm unable to sleep, I will be just listening to this. And you will find that these sort of resources are multiple. Okay, they will be having a 3 hour, 4 hour, 5 hours, 10 hours, a long duration music, just something playing in the background, and you just keep your mind on that music, or you just listen to it. It can be something else also. Okay, but the backup plan has to be ready for you, so that if the sleep doesn't happen, or if you are having a major problem with the sleep, so we can smoothly switch over to your backup plan. And the fifth remedy is mindfulness. So you can just try mindfulness. It is a stress management thing, and it can be helpful. Okay. I will be talking a little more about this mindfulness thing, so that you get a little more idea about this and you can start with this. I think these are the remedies. They are simple, but they are super important, and they can solve many of your problems in that way. Oh, regarding the stress management thing, someone was asking about how to understand that you are into stress, or what is the amount of stress. There are a lot of tools available in the internet. You can just go and ask that how stressed I am. So they will be giving you certain tools where you can do this. One very scientific way of doing this is, there is a score called as perceived stress score, or PSS. Uh, it is usually a 10, PSS 10, which is the most validated one. So it has 10 questionnaires and a few options. So you can just download it from the net and you can answer it, and you can make out that what is your stress score. Yes, regarding meditations, someone of you is asking about some backup plans of meditations. So here it will depend upon your familiarity with the type of meditation. Okay. So if you are into mindfulness, those who practice mindfulness regularly, daily, in mindfulness, there is a very famous meditation called as body scan meditation, or body relaxing meditation, that is already scientifically known to give rise to good sleep. Okay. In other forms of meditation, there can be other methods which you can try. So there can be, that will depend upon the school of meditation. And yes, there can be different other ways. It can be story books, it can be other books. For me, I think the best one is reading a book, a medical book. So if I just take on a book, start reading a book which is related to my field of science, medical science, I am rest assured that within 10-15 minutes, I will get into a deep sleep. So it will be different things for different people. And you have to find out your own method through which, uh, or your backup plan. You have to devise it yourself, because we are different individuals, so the methods will vary from a person to person. Now let's talk a little bit about mindfulness. So those who don't know about mindfulness, mindfulness is something, it has a formal definition. So it says that to keep your mind in the present moment, uh, with a purpose and staying non-judgmental to it. So a little complicated definition. And to make the thing simple, let's think of this like that you are trying to keep your mind in the present moment, and you use different mediums to practice this. One very common medium can be your breath. So you connect to your breath, and this breath helps you to keep your mind in the present moment. This is just a very oversimplification of uh, explaining mindfulness. But I would like to say something. Uh, as you start with the process, there are certain things happen. So those who have been into the training of mindfulness, until now, mindfulness, it is recommended that you learn it through a structured process. And even it may so happen that even getting into a structured process, it may get a little difficult to learn. So it so happens that a lot of people need a lot of interactions with the instructor, and maybe you need to retry and learn it again and again. So unless you are into the process for a period of time, it's difficult to understand that what it is actually trying to teach. So it's quite like learning swimming. So you can get a lot of instructions about swimming in the internet or from people who actually can swim, but that doesn't help you, because unless you get into the water and you try to start with the swimming, all these understandings are not very clear, and the instructions also are not clear. So you have to start with the process, and you have to continue with the process. So I remember that when I started swimming, after a month or two, I found that I couldn't swim. Okay. So I left that process. So this happens with mindfulness also. Most people, when you start with the process, and we have very high expectations of everything, so it is very common that it so happens that within a month or two, you are not seeing a significant change. So you leave that process. But these processes are something which demands your time and effort, and you get the results after a little period of time. So when you invest some time, then only they are going to give you the results. It's quite like our FDs or our investments or SIPs, which we do. So if you are doing a SIP or if you are doing an FD, and you are every day you are checking that how much your money has grown, okay, and every week or every month you go on checking. So, and you get very disappointed because you will see after maybe a month or two, the money has not actually grown. But if you just stay with the investment process, you will see that after 1 year, 2 year, then you have will be getting the benefit of the process. Okay. So here also with mindfulness, you have to stay with the process. You have to stay inside the water. You have to keep on trying swimming, and then you will see that how it is helping you. So as I was saying, as a simplified version, that you try to keep your mind on a medium, because your mind is just moving here and there, it is everywhere. Okay, it is just buzzing around, and you are training it to keep it in the present moment. Maybe you are using your breath to do that. So what happens that as you go on training it, as you go on bringing it to your breath again and again, and you go on trying this persistently, maybe for a period of time, after some time, you will find that the number of thoughts that is in your mind, they start decreasing. This is a genuine finding. Those who are into this process, they know this, that after a period of time, you will see that the number of these random thoughts or these garbage thoughts, which is continuously disturbing you or continuously going on in your mind, they will start decreasing in number because you are training your mind through this mindfulness process. So, what is going to happen if the number of thoughts decrease in your mind? Your mind is getting calm. Okay. So, you are having a more peaceful mind, you are having a more calmer mind. And this explanation is scientific. It is not that I am saying or something mystical is happening, not like that. Because you are trying to bring your mind to the breath in every opportunity through different practices or to some other mediums, as you are continuously trying to do it for a period of time, so automatically your mind calms down. Okay. And if you can just relate to that story with which the session started, the real life story. So the minds are our reflection of our lives, and minds are directly related to our sleep. So once your mind becomes more peaceful, once your mind becomes more calm, so the secondary result which comes to you is your sleep gets better. You are getting better and better sleep. The more you train your mind, the more you make your mind calm, obviously you are going to have better and better quality of sleep. So it is addressing your sleep problem in that way. There is also other ways of addressing the problem through mindfulness. In mindfulness, we have a concept called as non-striving. So here we don't force anything. So this is a basic understanding in mindfulness, that we don't force anything or don't put too much effort into something. So it is quite like flying a kite. So if you are flying a kite, the string through which you are flying the kite, if it is too taut or if it is too loose, both the situations are not helpful for you for flying the kite. Similarly, in the practice of mindfulness, if you are giving too much of force or if you are giving too much of effort, that is not helpful. If you are too much casual, you are too lazy, you are too lax, that is also not helpful. So a middle path has to be there, which we call as the non striving attitude. And once you follow the process of this or you adopt this attitude, the same attitude you also need for your sleep. Because you see, most people, when they are not getting into a good sleep or the sleep is not happening, so you are lying on your bed and the sleep doesn't come. So what do? You get panicked. You try, you force, you try to bring it more and more. Your mind is getting entangled in more negative thoughts that if it doesn't happen, I will try it for 5 minutes. I will give in more effort for the next 10 minutes. But if it still doesn't happen, so you are getting entangled in your own mind's cage, and you are putting in more force and trying to bring it. Actually, you are doing more harm to yourself than doing any benefit to yourself. So, sleep is something which you cannot force. You cannot voluntarily drag it or force it and let it come. You can only create some environments or certain situations which can be helpful for your sleep. Okay, so if you just remember the points mentioned in sleep hygiene, those were certain secondary things where you are modifying certain factors and you are just making your environment more easy so you can get to sleep. Okay, so if you understand this, this non-striving attitude is very, very important. Don't force your sleep. If it comes, let it come. If it doesn't come, that is also fine. And as I said, that just for the time being, if you find, just switch over to a back off method. It can be listening to some relaxation music or just casually reading some book. It can be doing some meditation practices. So just set up a backup plan and just go on following it. This non striving attitude is going to help you to get a good sleep. Okay, this is a core concept in mindfulness, and the same concept appears for having a good quality of sleep. And there is another very interesting thing. This is related to the ancient wisdom. You see that this is a concept which is very different from our modern life concepts. So in our modern life, we look at life in a very different way, and we just pick up habits and pick up things from the people around us, from the society around us. Just ask yourself, you live in a country, okay, you live in a country which is the second most sleep deprived country in the world. So where you stand? You live in a country which is number one in mental health problems. Okay. You live in a country which is one of the last 10 countries in happiness index. So it is one of the most unhappy countries in the world. So you see these parameters and you look at your country, you will understand where you are living. So here, if you are picking up habits or if you are learning from people around you, most of the people are doing things wrong. So you pick up wrong things and you start doing wrong things even subconsciously. So what you are doing, you need to ask yourself, you need to challenge yourself, and you need to make out that whether you are doing things in the right way. So in mindfulness, there is a beautiful concept of something called as non-doing. In modern life, this concept is missing because we are always doing things and we measure our productivity or we measure ourselves, that how good we are in terms of doing, that how much work I can do, or how much I can multitask, how much things I can do as a doctor, how many patients I see in a day, or as such and such person, how much work I do. So that is how we define ourselves or our productivities. So this concept of non-doing is something which we miss in our modern society. Here, the non doing says that we are not human doings. You call yourself a human doing? No. You say that you are a human being. So, this concept says that you have to be first be present. You have to be first a human being. Doing comes later, much, much later. First, you have to be present. You have to be there. And this is called as non doing. You are just present in this moment, in your life. And this is something which is very, very important. This concept is totally missing in our modern life. And how many of us we know to relax ourselves? So if I ask you that I will give you half an hour time, and you just anything you do to relax yourself. So you will be just switching on a TV and just watching it, or you will open up your laptop and you just start watching something, or you will be just scrolling through your phone and watching something in the social media in that half an hour time, or doing something else. Is that relaxation? A definite no. That is not relaxation. Relaxation is an art. Relaxation is something which the modern society has forgotten. Relaxation is something where your body will relax, all the parts of the body will relax. The relaxation will go deep, even to your muscles, even to your bones, even deep down to your cells. Your mind will completely relax. That is relaxation. It is not just going through certain digital medias or using certain other things and just engaging the mind in that thing. It is an art. You will need effort, you will need understanding to develop relaxation. You have to learn it, you have to practice it. Then, after a period of time, you will be slowly able to relax. So, modern people, they have forgotten how to relax. They don't know. If I tell you relaxation, they think, okay, okay, oh, you are giving me half an hour time. You are giving him 1 hour time. So just I will engage my mind into something and do that. So that is not relaxation. That is not non-doing. So if I tell you that practice non-doing, so to understand non-doing, it will take you a lot of time. That what is non? You know, doing. No one talks to you about non-doing. I will give you some examples. If we look at our sages or very elevated people in our society, you will see that they don't do anything. They are just present. Even they do nothing, they do something which we still remember. I can take some names. It can be Sri Ramakrishna, it can be Sri Ramanna Maharshi. So these people, very elevated, high spiritual people, if you look at their lives, they have done nothing in those terms, that they have not worked, they have not been to offices, they have not done certain, in our terms, productive, yet their presence in their life is something, and maybe they have spoken a few words, or maybe they have not even spoken, they have been just silent, and their presence is something which is related to non-doing. And still, these people are quite old in that sense. They have left maybe 100 years back, 150 years back. And still, we take them as idols, or we take their teachings as something very important and very helpful for our lives. Actually, they have lived that actual life, that life which is valuable. So, for that, we need to understand that why we are into this life, what is the purpose of our life, and what we are doing in our life. Okay. So, this is very important. Start with practicing the art of relaxation and non doing. If you even get to some amount of it, your life is going to change. This is also a very important thing in mindfulness. So you can see that in so many ways, mindfulness can help you in your life and also help you in having a better sleep. So, just coming back to that story of that lady who was practicing mindfulness for around 3 weeks, and at the end of the third week, she called me up and said that after 1 year time that I have not slept, I have started sleeping because your mind has started changing. It has become more calm. You have switched over to a non-striving attitude. Slowly, she was getting into this art of relaxation and non-doing. So the whole process was actually helping her to get a good sleep. So we are just at the end of the workshop, and I would just sum up the teachings. So many of us, we are having sleep problems, and it is very common in our society. So if you are suffering from a sleep problem, or you know someone in your family or in your friends or your near and dear ones who is suffering from it, so don't just quickly jump on to medicines. That is perhaps not a very good remedy to start with certain medicines. Try with the sleep hygiene, try with the simple things, certain changes, certain choices which you can execute. Find out where you are going wrong, what is causing this disturbance. That simple understanding, that simple finding out will help you to tackle your problem better. And you can try mindfulness. This is a very good tool, a very scientific, interesting tool, not only for your sleep, but also to understand and handle your mind better. So, with this, I will be concluding this workshop. I will not go into the question answer part because I have exceeded my time. I hope that all of you have enjoyed this session. You can give the feedbacks in the WhatsApp group that, and if you have any queries, I will try to answer them in the group or in other ways. So my gratitude to all of you for coming in and joining the session. Thank you. Thank you very much.